And hello, ladies and gentlemen. Welcome to Big Talk with Bruce Dickey here on this beautiful Tuesday morning. By the way, it's Tuesday. I didn't know. So this is actually your second day back from vacation.
No. It's my first day back from vacation.
No, this is Tuesday. We're shooting it on. Okay. Brandi gave it away. We're shooting this on Monday, but we're going to talk like this is Tuesday mornings because you're all going to see this on Tuesday here on a Big Talk with Bruce Dickey on Wabash Cats TV. Appreciate you folks tuning in today. We are going to talk all day long today about the Clay County Health Department, what they have coming up, as well as some of the fun awards. I guess fun. Did you have a cake or something to celebrate the awards? So was it fun?
No, but we should.
You should.
Jeff, we should have a cake.
There you go.
Yes,
absolutely
yes.
should have a cake.
And ice cream.
And ice cream. That's exactly right. We're going to talk all about the Clay County Health Department today, and we are going to have a good time talking about it. They've won a pretty doggone nice award, and we'll get to that here in just a moment with Kris as well as with Brandi here, and then Meredith is going to be joining us here in a few minutes. Before, though, that we do that, see, now you ladies are off camera. You see there that it's, boy, I'm like shiny or something. That is terrible. I might need the Clay County Health Department. What is going on here, ladies and gentlemen, on Tuesday, June 4th? There are a few things going on today. Okay. I'm only doing the show today and I think Thursday this week. I had other things going on the rest of the week, so I'll probably give you some items for throughout the next few days. Starting with Wednesday night in Olney at the Olney City Park. It's the first night, the first Cummins Municipal Band concert of the season. It is at 7:30 in Olney City Park. I don't know what we're playing yet, but it'll probably be pretty good. And then after that, on Thursday night, June 6th, the second concert of the year for the Fairfield City Band. That'll be on the Wayne County Courthouse lawn down there in Fairfield. Do you guys, are either of you, do you participate and or go to these band concerts? No. Say yes. Say yes, make me feel good.
Yes.
Yes, absolutely. Kris is good. She's getting the show now.
Yeah.
She's understanding exactly what I'm talking about. Yeah. They're a lot of fun. They play for about an hour, and it's a good time. Everybody has fun. Now, those are hopefully there won't be rain involved in either of those, but those are coming up later this week. What else is coming up this week? Up at Effingham, at the Effingham Event Center, today from 2 o'clock till 6 o'clock. It is a blood drive. Now, I don't know if this is the Red Cross blood drive or the blood drives that they have up in Effingham County. So I can't tell you which one it is, but I do know that if you go to the Effingham Event Center today, you will be able to donate blood. Now, that's always a good thing to do. What else is going on this week? Wednesday night on June 5th at Village Wine and Spirits up there in Effingham at 7:30. It's full band open mic. This is if you decide not to go all the way to Olney. You can go to Effingham and enjoy open band microphone. Now, this is what Bill Passalacqua does up there in Effingham. They up at the Village Wine. This is every songwriter open mic. They come in. You can now, since it's the first one of the month, again, it's the full band. They'll have a band backing you. So if you're a songwriter and you're interested in that, by all means, do go to that. That'll start at 7:30 on Wednesday night, so don't miss that. That'll be fun. What else going on today, ladies and gentlemen? This is, oh, I've always got the best ones. This is National Hug Your Cat Day. National Hug Your Cat Day rolls around each year on June 4th. The perfect, you get that? Perfect opportunity presents itself for some snuggle time. Depending on your feline critter's nature anyway, hugging may or may not be in the cards. However, like most animals, maybe touch is a vital part of communications, and the same goes for the clawful kind. Now, do you ladies have, or do you have cats to hug, or have you ever had a cat?
Oh, I have several cats.
Yeah. Inside or outside?
Inside. They don't like to be hugged.
They don't like to be hugged. See, now we've had 3 cats. We've had 4 cats in my life, and about 2 were huggers. The other 2 were nowhere, nothing to do. How about you, Kris?
I don't. Well, I have barn cats, but you ain't gonna catch them.
No, you don't want to. No, I got to tell you, if you caught a barn cat, I don't think they'd be very huggy.
No, I don't think so.
Absolutely not.
No, and I see this picture of this dude with this cat. We had a Russian like that, a blue Russian like that. And he would basically, whenever you would set him back in your arm like a baby, he would stick his paw up on your forehead like he was healing you. It was the weirdest thing you ever saw. My wife would always yell whenever they had the cat in her arms, "Heal! Heal me! Heal me!" That cat is healing others now. But yeah, this is a fun day, folks. National Hug Your Cat Day. It's a great day to cuddle. Cuddling with cats can decrease bouts of depression and loneliness. Hugging your cat also helps you feel more calm and relaxed, which results in lowering the risk of heart disease. I'm not sure I believe everything these people claim, but that's what it says. The sound of purring has a healing component to it that can actually help heal your bones and muscles. Wow. People who sleep with their cats get better sleep. Now, okay, do you sleep with the cats? Do you let them on the bed?
Absolutely.
Do you get better sleep, you think, if your cats are around or if they're not? What do you think?
Depends on the cat's mood.
Well, yeah, that's exactly right. It depends entirely on the cat's mood. If the cat is, feisty, it may not be a good night to sleep with the cat. So who knows? And children under the age of 1 who are exposed to cats might have fewer allergies as they get older. I had no idea. I got to try that. I've got a niece. I wonder if my niece's parents will let us bring cats in to try to affect allergies. I kind of have my doubts as to whether that would happen. But that's a whole other thing. Cat Snuggling Day. What else is going on today? This is National Cheese Day. National Cheese Day is on June 4th. An encyclopedia of cheese will cover the alphabet and broaden your vocabulary, and undoubtedly contains more variety of cheese than what you can find at your local grocer. Cheese is produced from the pressed curds of milk. The milk can come from cows, buffaloes, goats, sheep, wherever. The temperature and aging affect the flavor and texture of cheese, as well as spices and other seasonings added in the process of making cheese. There's a good-looking crew of cheese right there. In the United States, a road trip to Wisconsin isn't out of the question for quality and variety. I can attest to that. The cheese up there is better than anywhere else in the U.S. Many ways to celebrate National Cheese Day. Try a new recipe and maybe a new type of cheese that you may not normally use. So a fun way to celebrate National Cheese Day. What else is going on today, ladies and gentlemen? This is June 4th is also, now this one I won't get into. I don't much care for it. This is National Cognac Day. Each year on June 4th, brandy lovers and distillers celebrate National Cognac Day. It's a well-known variety of brandy. Cognac was named after the region in France, Cognac, France, where it's produced. The region is also known for vineyards and producing wine. A distilled brandy must meet certain legal requirements within production to bear the name cognac. In fact, one requirement during production includes the use of a particular variety of grape called Uni Blanc. So there you've got to have that Uni Blanc in there. Producers can create close to 200 different cognacs to choose from. According to one 2008 estimate, more than 80% of cognacs in the United States comes from only 4 producers. Grand Marnier, some different cognacs, Pinot de Charente, Domaine de Canton, and Vieux, which is Dutch brandy. So I am not a big, do you guys, are either of you big cognac fans?
No.
Don't know that I've ever tasted it, but I'm all for brandy since that's
I
the
gotta
name.
tell you, yeah, Brandy's fine. Yeah, Brandy's your name. That's exactly right. That makes a ton of sense. But I must tell you, yeah, I have tasted cognac like once or twice, and that's plenty. I was at a fancy restaurant. I thought, well, they're offering cognac for dessert. This sounds fun. I've got $7 or $8 to spend on it, and that was the last time. So what do you do? What do you want to see on television, ladies and gentlemen? What do you want to watch on TV? Just Major League Baseball tonight. Chicago White Sox are at the Chicago Cubs. That is going to be Chris Flexen versus Shota Imanaga, and that's on Marquee Channel 597. Also on NBC Sports Chicago Channel 643, depending on whether you want to watch the Cubs version of events or the White Sox version. You never know. Cardinals are at Houston tonight. That's on Bally at 7:10. It's Andre Palante versus Spencer Arrighetti, spelled just like spaghetti except with Ara as opposed to spa. And also Minnesota is at the Yankees on TBS at 6:10 p.m. That's on Channel 632. We are going to talk all day long today about the health department, the Clay County Health Department, with Kris Snell and Brandi Young, as well as Meredith Weaver is going to come up here in a little bit. You're watching Big Talk with Bruce Dickey. We'll be back right after these words. Stick around.
When you want an honest deal and hometown service without the runaround, go to Lamont Chevrolet Chrysler in Fairfield. Let Gabe McGahey, Sheldon Bunning, Jeff Black, Dennis Downs, Matthew Rogers, or Caleb Dunn score the best deal for you on your next new or pre-owned vehicle. Parts and service departments with factory-trained technicians and express lane and state-of-the-art tire and alignment technology. Lamont always inspects your battery, antifreeze, wipers, and tires for free. We want you prepared for the open road ahead. Open 24/7 at LeMansOnline.com. You'll like the way we do business.
At Clay City Banking Company, we're all on the same team, regardless of zip code. At home, work, school, or across the country, you can be part of our team with our cutting-edge mobile banking products. From your hand, you can check balances, transfer money, make deposits, and pay bills. Looking for a loan? We've got you covered with our mortgage, agriculture, commercial, and consumer loans. Join our team today. Clay City, Flora, Louisville, and Fairfield Banking Companies. We're the hometown banks, member FDIC, and equal housing lender.
Chapman's Furniture has the best prices every day. You can find them open Monday through Saturday from 9 to 5 and located at 210, 300, and 306 West Main Street in Salem. Chapman's features a full line of furniture, including Ashley Furniture, bedding by Sealy and Bimco, and the largest selection of rugs in Southern Illinois. They have a huge selection of recliners, including lift and power, and wallpaper and border in stock at closeout prices. Call 618-548-2221 for the best price around.
Briscoe Surplus Sales on the northeast edge of Flora is your one-stop do-it-all shop. Looking for rugged boots and footwear from great brands like Lacrosse, Rocky, and Carolina? They're there. How about top-notch small engine parts and service? Briscoe Surplus Sales has it. Whether you're wiring your switches or switching your wiring, Briscoe Surplus Sales has the solution and the know-how to help you get the job done right the first time. Briscoe Surplus Sales, your one-stop do-it-all shop.
It is all things new at Zimdar's Heating, Air Conditioning, and Appliance Repair. We have a new line of heating and cooling equipment and new technicians. Our new equipment line offers 24 months free financing and excellent warranty coverage. Our experienced service technicians can provide you with quality service and repairs on all brands of HVAC equipment. Zimdar's has been serving Clay County and the surrounding areas for over 23 years. The employees of Zimdar's are here to help, so call local and call Zimdar's.
Hello, ladies and gentlemen. Welcome back to Big Talk with Bruce Dickey here on Wabash Catch TV. I'm joined by Kris Snell down there. Good morning, Kris. Thanks for being here.
Good morning.
Appreciate you being here, and as well as Brandi Young. Thank you so much for being here, Brandi.
You're welcome. Good morning.
Did I spell your name right, by the way? Is it Y or an I?
It is an I, but that's okay.
Oh, I forgot to ask. I feel so stupid now.
It's fine.
Well, I'll try to correct it here eventually. Okay, ladies, you are, now tell me what your jobs are. You both work for the Clay County Health Department. What do you do?
I'm the home care director.
Okay.
So I'm oversee the home health and hospice programs.
Uh-huh.
And I've been at the health department for 35 years.
No kidding.
No kidding.
How is that possible? You start in grade school?
Not quite.
How about you, Kris?
I am the home care coordinator, so I am over like the clinical part of home health and hospice.
Okay.
And I've only been there 6 years, so.
Okay, well, you see, now you got a little catching up to do with,
I do, yes.
Brandi. Tell me a little bit. Now, I am under the understanding that the hospice just won a large award. Tell me about that.
Yes. So our hospice program won the 2024 Hospice CAPS Honors Award, which is based on our CAPS survey. So let me tell you what CAPS stands for.
Yeah, tell me what CAPS is.
It's Hospice Consumer Assessment of Healthcare Providers and Systems.
Okay, so what's the CA mean?
Hospice Consumer Assessment.
Consumer assessment.
Yes.
Okay, and they just put them out of order.
Yes. Yeah, yeah, there you go.
I'm trying to understand why they put them out of order. No, I'm terrifically confused. How often is this survey taken?
So it's done every year. This range went from October 22 to September 23.
Okay.
Was the date range. And then they announced the awards. This is actually the third time that we've gotten it.
Oh, really?
Yeah. So we got it in 2019.
Nice.
And then again in, I cannot tell you. It's either 2021 or 2022.
Well, see, now those were probably even much more difficult times to run a hospice plan because with all the different COVID and things,
Yes,
the
yes,
protocols that you had to deal with.
Correct. Yes, that was a difficult time for us.
Okay, so now what are the questions? Do they just say to are the patients asked, or the patients' families, I presume, are they asked, do these people just barge into the house and start like automatically cleaning stuff around? That's not exactly how it works, is it?
So surveys are required by CMS, Medicare.
Okay.
So every agency has to have a survey sent out to each patient. The surveys are sent out to the families, and there's about 24 questions that they have to answer, and they're based on services. So, how was the nursing services? Were you happy with the services? Would you recommend our hospice services?
Right.
Questions like that the families have to answer.
What are the typical hospice services? What is typical provided to patients? And I mean, are they? Whenever you start talking about hospice, it's a scary thing for people.
Yes, it is.
And I'm trying to find a best way to make it familiar to people because it's something that really doesn't have to be scary, is it?
Correct, yeah. So, like you said, a lot of people say hospice is a scary word. To them, it means as soon as I get on hospice that I'll be passing away pretty soon, but that's not what it means. We actually like to have our patients on hospice a long time, so the sooner you get on hospice, the better. With the diagnosis, you have to have a terminal diagnosis of 6 months or less. But to say, as long as you're showing a decline, we can keep you on hospice services longer than that.
It kind of makes it. It kind of makes it up to the. Well, you call it a terminal situation, but it's up to is it up to the patients or up to the doctors, or whenever hospice is brought in, or how's that
both.
typically
it's
done?
Both.
Really?
Usually, our physicians tell them, there's nothing more that they can do for them. So just comfort measures, So then, and we've had some families call and say they want hospice too. So it can be up to both, but we still have to get the physician's permission, and they have to sign the orders and everything for that. And we've had we have cancer patients that have COPD, congestive heart failure, that just don't want any treatment. They just want to be comfortable.
Yeah.
And so that's what we're for, to keep them comfortable in their home, Or they could be in a nursing home also or in a facility. But it's like pain management, respiratory management, just things to keep them comfortable where they're not having to go back and forth to the hospital and doctor's appointments.
What is typical for the Clay County Health Department to be covering at any one time? How many patients in hospice would you think is typical?
When I first started 6 years ago,
Yeah.
they had 25 patients in hospice.
That seems like a lot.
That was a lot.
Yeah.
We are currently up to, I'm going to say 11 because we have 2 new ones. So as of tomorrow, we'll have 11 hospice patients.
How many employees do you guys have, do you use in the hospice, not the hospice facility, but in the hospice program going out to homes?
Okay, so our nurses are cross-trained, which means they do hospice and home health services. We currently have 5 field nurses. 3 of them do more hospice than the other 2, but we do have 5 field nurses.
Here's a little bit more information about the home health and hospice. 3-time recipient of the CAPS Award, as Kris was mentioning there. Tell me about some of the things that you speech therapy for hospice. I guess that would be more on the home health side, wouldn't it? The speech therapy, Brandi?
Yes. Yes.
Tell me about some of those things on the home health side that you folks will do.
Okay, so for...
Okay, no, but first, did you guys get part of the award too?
Well, we have the same staff, so yeah.
So yes,
So
absolutely.
technically, yes.
Yes, good. Good. Congratulations to you too.
You're welcome. Thank you.
Tell me a little bit what home health does, what the differences are between that and hospice.
Okay, so for home health, it is more of a, not curative, but rehabilitative type of service. And we are working with patients with skilled nursing, physical therapy,
Yeah.
speech therapy, social work.
Sure.
And it also requires a doctor's
Right.
order. A doctor or a hospital sends the patient's information to us, and then we contact the patient and go
Okay.
into their homes. It's provided in your own home.
So it is. So all these services are in your own home. They aren't bringing them in to the health department or anything like that.
No, it's all in their home. Now, on the hospice side, we also do go to long-term care
Yeah.
facilities and provide care there too.
Tell you what we're going to do, take a quick break, come back, talk a little bit more about how Brandi won the award too. I'm just teasing. We'll be right back on Big Talk with Bruce Dickey after these words. Please do stick around.
Hi, my name is Landon Carter, and I'm a financial consultant at Benjamin F. Edwards in Flora. Whether you're planning to send a loved one to school, preparing for retirement, or passing your wealth to the next generation, we have the knowledge and perspective to implement financial strategies that will help you move smoothly through life's transitions. Here at Edwards, our clients know that we are fully invested in their financial future. To find out more, Cole Duke and I invite you to give us a call at 618-508-8050. Benjamin F. Edwards, member SIPC.
When you want an honest deal and hometown service without the runaround, go to Lamont Chevrolet Chrysler in Fairfield. Let Gabe McGahey, Sheldon Bunning, Jeff Black, Dennis Downs, Matthew Rogers, or Caleb Dunn score the best deal for you on your next new or pre-owned vehicle. Parts and service departments with factory-trained technicians and express lane and state-of-the-art tire and alignment technology. Lamont always inspects your battery, antifreeze, wipers, and tires for free. We want you prepared for the open road ahead. Open 24/7 at LeMansOnline.com. You'll like the way we do business.
For service beyond the surface, call Carter Trucking in Fairfield. Carter's trucks are ready to haul your big freight and grain. So whatever you call Jeremy Carter, the Mucho Mulcho Man, the driveway doctor, the gravel guru, the pothole pirate, the rockin' redneck, the smooth operator, the mudhole master, or the happy hauler, just call him. 842-2022 to haul your big freight, grain, and more with trucks from Carter Trucking, Williamson Drive in Fairfield.
But now we are. Microphone. Ladies and gentlemen, the magic of television. It's not that magical, but I tell you what is magical. Look, I fixed her name. That's what's magical.
Thank you.
Glad to do so. Joined here today by Kris Snell along with Brandi Young, and Meredith Weaver is going to join us here in a few minutes as well. We're talking about the Clay County Health Department and their honors that they have won. Let me see if I can't. There's the hospice honors. No, so you guys, Kris, you pulled this out of the frame to give to me today?
Yes. We want it behind you.
You want it behind me? Okay. Well, I got a little room up there somewhere. Yeah. Is this really my copy to keep?
You can have it.
Oh, thank you so much. I appreciate that. I will hang it proudly as an award winner. Again, we're talking about the Clay County Hospice and Home Health Department. You have the staff there that can help. What are you doing serving all those counties? I thought you just served Clay and Effingham County. When did you start serving all those other counties?
Oh, we have been serving those counties for quite some time. Effingham was probably the last one that we've added, but we basically serve all of the counties that surround us.
Okay, so now this is the crew that the crew that she was talking about, 5 nurses that you go to all those different places, huh?
We do.
It's not just Clay County. Kris, when you were telling me about the 11 homes, this is not just Clay County.
Yeah, no. We cover 6 counties for home health.
Okay.
So that's Clay, Richland, Effingham, Jasper, Marion, and Wayne counties for home health. And then in addition to those counties, we cover Edwards and Wabash for hospice.
Oh, really? So the Edwards and Wabash, do they have their own home health services or something, or are they just, the grant hasn't gone that far yet?
There are some home health agencies in the surrounding areas that we do compete with, yes. But yes, we cover those counties.
Okay, tell me a little bit, if my doctor or my family contacts, or if I contact for a family member for hospice services or for home health services, am I paying? Am I going to pay a gigantic amount of money for this, or how's that paid typically?
No, generally you are not going to have hardly any or very little out-of-pocket costs for that.
Really?
We provide billing for those services, and we bill Medicare, Medicaid, private commercial insurance.
Oh, really?
Medicare Advantage plans. And so
typically,
unless they have a out-of-pocket copay or a deductible, you won't be getting a bill from the Clay County Health Department.
What exactly give me the difference between, you said home health is more for rehabilitation versus hospice is for end of life
Correct.
services. What level of service does, for instance, end of life cover? I mean, dispensation of pharmaceuticals, or what all is covered? I guess. It's been so long since I had a family member on hospice.
Yeah, that's okay. So no, what hospice covers, again, like I said, it was comfort care. We provide skilled nursing services. We provide a bath aide to come in to help you with personal care and to kind of relieve your family from having to do that. We have pastoral care, so if you wanted a pastor to come in, we do offer that. We have volunteers that come in the home and assist with things. They can sit with your family member while you go run some errands for a little bit. They can play games. They can do anything like that.
I imagine that kind of support service is tremendously helpful to a family, especially the part where you might be able, a family member might be able to get away for a little while or something like that.
Yes, correct. Because typically when a patient's on hospice, they have to have 24-hour care in the home because they're at that point. So yes, it does help. And then we have social workers also that can assist with like bereavement and helping the families cope. And
It's just kind of more of a, it's kind of a different choice, isn't it, than like going to the comfort rooms at a hospital or something like that, right?
Yes, yeah. And we want to do it in your home. I mean, a lot of people want to be home.
What do you think? I just had in the last couple of weeks lost a friend to cancer, and she, by golly, did not want to do it at home. Because she didn't want the family to have memories of her losing her battle at the house. What is typical, or is there a particularly typical decision made by folks?
Yeah, well, I can say, like, out of the census we have now, a majority of our patients are at home, in their home. We do have some, if they are not wanting to stay at home, they're pretty much go to like a long-term care facility. Or, like a long-term care facility in the hospital.
You're right.
So,
like the second floor or something at some particular hospital. So there's really nothing typical, is it? It just kind of is whatever the family decides or the patient decides they want, right?
Yep.
They
receive the same care.
Focuses on the family and their caregivers, their family. And
well, you see, now that's why, ladies and gentlemen, they keep winning the gigantic awards that I'm going to be putting on my wall. I'm so proud to be able to throw that on the wall. Well, ladies, I appreciate your time. I appreciate you being here today. We're going to, do you have any other questions or anything I missed?
No, but I have one more thing.
Go ahead.
If you don't mind. Okay. What we always want to say is we know a lot of community members doctor at Only, or they go up to Effingham or whatever. So if you want Clay County home care services or hospice, you have to just let your physician know that. Even though you doctor in a different county, you can still have Clay County as your home care.
Well, like you see, you've got Clay, Jefferson, Marion, Wayne, Richland, all you've got there, all those counties there, and that's the thing. You guys are the award winners.
Yes.
I mean, you might be the ones you would be the ones that folks would want to talk to.
Yes.
Yeah, and we are local.
People
we're part of our county.
Outstanding. I tell you what, I learn so much every time I talk to folks. I appreciate you, Kris. Thank you so much for being here. Brandi, thank you so much for being here. We'll be right back. Meredith is going to come sit here, and we're going to chat about all kinds of stuff coming up with the Clay County Health Department. We'll be back right after these words. Stick around. Having car trouble, need a tow, or just some routine maintenance? Butcher Automotive in Louisville has you covered. Locally owned and operated, Butcher Automotive offers complete vehicle repair services along with tire sales and wheel alignment. They're your local Hankook tire and interstate battery dealer. Butcher Automotive offers free local pickup and delivery so your car can be repaired while you're at work or at home. Butcher strives to treat everyone's vehicle as their own. At Butcher Automotive, they don't want you to give them your business, they want to earn it.
Residents of the Clay County and surrounding area have relied on Clay County State Bank for sound professional service for over 100 years. With convenient lobby and drive-up hours, we are ready to serve you Monday through Saturday. We appreciate all who bank with us, and we look forward to the opportunity of working with anyone who is looking for a community bank to help with their financial needs. Give us a call at 665-3314, visit us online, or stop by and see us on the square in Louisville to experience our friendly personal service.
When you want an honest deal and hometown service without the runaround, go to Lamont Chevrolet Chrysler in Fairfield. Let Gabe McGahey, Sheldon Bunning, Jeff Black, Dennis Downs, Matthew Rogers, or Caleb Dunn score the best deal for you on your next new or pre-owned vehicle. Parts and service departments with factory-trained technicians and express lane and state-of-the-art tire and alignment technology. Lamont's always inspects your battery, antifreeze, wipers, and tires for free. We want you prepared for the open road ahead. Open 24/7 at LaMonsOnline.com. You'll like the way we do business.
I thought I'd lost my business in that fire, but my agent was there before the flames were out. He said, together, we're going to rebuild. Our employees depended on it. My independent agent and auto owners made sure we didn't skip a beat. I mean, we didn't miss a single payroll.
For whatever lies ahead, we're always there. Auto Owners Insurance. North Wayne Insurance Agency in Flora is your local independent auto owners insurance agency.
Hello, ladies and gentlemen. Welcome back to Big Talk with Bruce Dickey. Look, it's magic. We have a new person sitting at the table. Meredith Weaver is joining from the Clay County Health Department, and we're going to talk about a bunch of stuff.
Yes.
Say, now, you must have been terrifically pleased when they got that hospice award, right?
Of course. My family's used the hospice services before,
Have
my
you?
mom and my grandparents, and
Yeah.
I worked in a hospital before as a discharge planner, I'm a social
Okay.
worker, and so I know that they do phenomenal work.
That's fascinating.
Cannot go wrong with them.
That is fascinating to me. It seems that most folks, or a lot of the folks who work at health departments, both, I'm more used to Wayne County than anywhere else, but most folks are from the hospital side, and basically, they moved to the health department. Why do they move to the health department? Is it better hours, I'm guessing?
I came onto the health department during COVID,
Oh,
so, yeah. I was the person who called and put people in isolation. I know, which is why I try to do fun things now.
Yeah, I have.
People didn't like me very much during that, but
I bet they had the.
I also took groceries to people, though.
Well,
So
see,
I
now
was the
then,
resource manager.
You were taking
so-
groceries and dropping them at the front
Yes.
door.
And I have lived in this county my entire life, and
Yeah.
I had been to parts of this county I did not know existed.
I was in-
delivering way out in the middle of nowhere.
I was hearing them talk about the Iola, the Iuka Iola wind, or Xenia Iola Road, where all the wind was. Like, I've never been up there.
Yeah, well, I had been there, but farther out, and I didn't realize part of that was even still in Clay County.
No kidding.
So, yeah.
No, it's
But
a
I
big
got
co-
familiar with it, and we got everybody taken care of.
That's outstanding. Okay. The cool part about your job now is, though, you are in charge of making certain, helping folks get like kidney issues fixed, and tell me all about what's going on.
All right.
What do you want to talk to me
So,
about?
First of all, I want to hit on the Kidney Mobile just because it's coming on June 12th,
Okay.
which is Wednesday from 10 to 2, and it will be at the Health Department
Right.
in the conference center,
Okay.
or the conference room. It's the first time that we've had it here before, so it is a huge thing. You come in, they will have a person, it's all free of charge as well. So it's a screening. They will do your blood sugar, they'll do your analysis where they'll check, they'll do a urine sample, they'll do some other blood pressure. They might do a blood draw, it depends, to check your GFR levels and such.
What if I don't want to know my body mass index if I'm frightened of that?
I tell you what, I'm going to be one of the people going through it as
Yeah.
well, and I don't want to know either.
Yeah.
So they do a little, like at the end though, they will do a private little discussion with you to let you know what you can tell your doctor, take your test results, that kind of stuff.
Is this is it an adjunct to having a regular doctor? Should it be, can people who actually, I've got a regular doctor that I see on a regular basis.
Right.
Would this be a good thing for me? Because I don't think we've ever checked kidney stuff.
It's a good thing for everybody. We're finding so I want to make sure I get my stats right. So currently we have 37 million Americans that already have a kidney disease, many who don't know about it.
Wow.
Cardiovascular disease is the #1 killer with people who suffer from chronic kidney disease, and we know from our iPlan survey that we've done at the health department in Clay County, cardiovascular disease is one of our #1 issues that we have. So it goes hand in hand. Also then, diabetes and high blood pressure can come from having kidney disorders, and we do have a lot of people that suffer from those as well.
I'm fascinated. I see on your poster here that no fasting is required. I thought usually for the diabetic testing you wanted fasting for that, not for this particular test, huh?
I think they'll just factor that in.
Oh.
If you're having it done at the hospital, they would. This is going to be like a finger stick, like you see
Oh, okay.
diabetic people do. So it's
Yeah.
just a little finger stick to see
Well,
where
hey,
you're at.
I mean, this, and actually kind of, it's probably, if, now you said you haven't had it at the hospital yet, or pardon me, at the health department yet, but I'm presuming it would be the screening also to tell folks, hey, you're pre-diabetic, which is,
They probably wouldn't diagnose you with anything just on a liability issue, but they would say this is pretty high. You probably
Right.
want to talk to your doctor about
you
that.
you are
Yeah.
predisposed.
Like, I would be concerned if it were me. I'd probably talk to my doctor if it was high.
As a person who does have a regular doctor, and I occasionally I will get sticked once a year for all these things. Is this something that I would feel comfortable going to? I never get kidney scanned.
As
I know.
someone who's had quite a few stones in the past, like I said, I'm going to be participating on this just because I do have a doctor's appointment coming up, but he didn't order any of my kidney functions.
Oh, really?
And so I'm going to.
I guess
Go ahead and get it done for free.
you know, in the screening, it'll check for high levels of, I guess, calcium, right?
And protein.
To see if you're going to have see if you have predisposed for stones.
Yep.
Boy, Meredith, it stinks getting older.
I know. I'm not a fan of it myself, but it's better than the alternative.
I guess as opposed to the alternative, that makes a ton of sense. What kind of time frame are we talking about? What does a screening take out of my day? How much of this is going to take, you think?
My understanding, and they didn't, I will say they didn't give us actual information, or I didn't get it in that email. I would say, of course, it's going to depend on how long of a line we have, which we're hoping to have a really long line. 30 minutes to 45 probably by the time you get all of your tests done, and then have your little consultation with the people on site.
And I could probably take my phone up to the TV screen right now and hit that little scan me button.
And pre-register.
And take the picture of it and pre-register. How important is, it says walk-ins are welcome, but how important do you think does it need
The walk-ins
to be pre-registered?
are welcome. Pre-registration would just be helpful for us on our side of it, so we make sure we have enough staff and volunteers and everybody lined up, and everything set up in the conference room.
Since I have you here, and before we get to the other part of where we're going to talk about on the 21st, tell me about the health department. Do they still have can I get flu shots? When do the new flu shots come in, or are you not the person to ask?
I'm not a nurse, I'm a social worker. I know that they do still have flu shots. We've had people come in.
How about COVID shots?
We do still have COVID shots.
Okay.
If you're over 55, 65.
Perfect for me.
If you're over 65, I can't remember.
That's the thing. That's the only place where I've had my COVID shots done.
Okay.
Is at the Clay County Health Department. It's
We have them as long as it's been 4 months since your last one. If you're over, I can't remember if it's 55 or 65.
It's actually, I think it's over 60, or if you've got
right.
occasional,
or if you have a chronic disease.
Well, I'm overweight, so I mean, if that's one of the things.
Yep.
Barely, ladies and gentlemen, barely.
Me too. By this much. As long as it's been 4 months since your last COVID shot, you can come in and get one.
Okay. They still have do you know if you have both Moderna and the other one?
We did the last I heard. I don't know for sure what they have in stock right now.
Probably, I'll do that before. That's the thing. I'm like everybody. I'm putting stuff off.
Yeah.
Do you do something, or you probably run into all kinds of folks do that?
We do, yeah. People that wait till the last minute.
And when do you think, you don't know, I guess, I'm just asking the wrong person, when do you think you'll get the new 2024 winter shot, the flu shots?
I want to say last year they came in
September?
September sounds right.
Yeah.
August, September, somewhere in there.
Yeah.
So I haven't heard anything, but that's, I would think.
Okay, I'm going to ask you another one off the cuff that you're probably not prepared for at all also. What do you think about folks who are like anti-vaxxers and that kind of thing? Don't say nasty, terrible things, but people make their own decisions, but they might want to get the science behind it. Right?
Yes, I'm an advocate for the science behind it, and you have to make the choices that are right for you and your family, your kids, but definitely we want you to be well informed.
Yeah, just make certain you're well informed and not getting your information from presidential candidates. That's I'm sorry, she didn't say it. She didn't say it. I tell you what, let's do. We're going to take a quick break and be back with Meredith. We're going to talk about the stuff coming up later in the month. I am so scared of this next topic that because I'm worried to death about it. You're watching Big Talk with Bruce T. We'll be back in a sec.
Fashion is our passion at Carnaby Square. We specialize in customer service and have since 1980. Our multi-generational boutique features your favorite on-trend to classic famous maker fashions, footwear, accessories, and a massive inventory of Brighton. So come, relax, explore, and elevate your look with us. Everyone is welcome, where we always wrap it, tag it, and bag it for free at Carnaby Square in downtown Fairfield.
Briscoe Surplus Sales on the northeast edge of Flora is your one-stop do-it-all shop. Looking for rugged boots and footwear from great brands like Lacrosse, Rocky, and Carolina? They're there. How about top-notch small engine parts and service? Briscoe Surplus Sales has it. Whether you're wiring your switches or switching your wiring, Briscoe Surplus Sales has the solution and the know-how to help you get the job done right the first time. Briscoe Surplus Sales, your one-stop do-it-all shop.
Napa know-how.
At Flora Auto Parts, you can count on the Napa know-how experts to have the solutions to keep you running on the road or in the field. More than just your car, your locally owned Napa store carries a large inventory of parts for farms, heavy trucks, and just about everything that moves. Experienced counter people understand your needs and are ready to help with the perfect part at a great value. That's Napa know-how at Flora Auto Parts.
When you want an honest deal and hometown service without the runaround, go to Lamont Chevrolet Chrysler in Fairfield. Let Gabe McGahey, Sheldon Bunning, Jeff Black, Dennis Downs, Matthew Rogers, or Caleb Dunn score the best deal for you on your next new or pre-owned vehicle. Parts and service departments with factory-trained technicians and express lane and state-of-the-art tire and alignment technology. Lamont always inspects your battery, antifreeze, wipers, and tires for free. We want you prepared for the open road ahead. Open 24/7 at LeMansOnline.com. You'll like the way we do business.
Meredith is helping me through a very difficult time right now. As one gets older, you become a little bit more forgetful, and she's helping me walk through that.
Make it.
She says I'm going to make it, so I'm terrifically happy to hear that. Because the next subject just scares the tar out of me. Tell me what is going on June 21st.
So June 21st is, of course, the longest day of the year.
Mm-hmm.
So it's the day that they remember with, as you can see, the hashtag end Alzheimer's. There is no cure for Alzheimer's or dementia, but we're still striving for one. So the longest day is just, it's one of those things that it is the longest day. Also, if you know anybody with dementia or Alzheimer's, sundowners is you've probably heard of a sundowner syndrome.
What is exactly sundowners mean?
It's just the phenomena that whenever the sun goes down, people with Alzheimer's and dementia will become more active.
Oh, really?
Yeah.
Okay, I didn't know
My
that.
mom was a nurse in a nursing home for a couple of years when she didn't work at the hospital, and her terminology was like, they're just little Houdinis. Like, they can get out of bed and sneak around and move better than they could in the daytime.
No kidding.
Yeah. It's a weird phenomenon, probably just because of the darkness, and it makes it more confusing in the dark.
I guess it would.
Would be my guess. I'm sure there are more scientific reasons behind it.
We're talking about Alzheimer's, and the thought on the 21st is mainly to promote awareness, isn't it?
Yeah.
to promote awareness, and also maybe to get, do you guys do screenings at the health department
do.
for Alzheimer's?
I do, and you can call and schedule an appointment and ask for Meredith. I do screenings that are called, well, they go by different names, so they're like a mini mental assessment or a mini cognitive assessment, just to kind of see where you're at, if you're starting to have like some mild decline or if it's further. We do the screenings just as something that you can take along with you to your doctor's appointment. If you think you or a loved one, and I'm fully aware sometimes it's hard to get people in there. I have found, though, that for some people, it is easier to go see a stranger at the health department and say, well, this is where they said you're at, we should talk to the doctor, than for a child, an adult child, to go to their parent and say, hey, I think you're starting to slip.
Yeah.
That's not as easy.
The adult child doesn't want, well, first of all, the adult child might not want to face that.
Exactly.
Because they
Denial
realize,
is very real.
well, they realize they may have to end up doing all kinds of troublesome things over the next several years. And tell me a little bit about you have, pardon me, let me get the right one up here. You have this support group.
Yes.
Tell me about the
we have a support
caregiver
group. Our numbers are low. We had a few people that were attending, their spouses have passed away, so they aren't in the support group anymore. We're always accepting people to come in. We meet on the second Thursday at 10 a.m. in the conference room at the health department.
How long do you typically meet?
About an hour.
Okay.
So try not to make it too long so that they can get health care or caregiver arranged for their home.
Well, that's the thing. You got to have somebody, a caregiver potentially, to watch the patient.
We can do it via Zoom as well. We have that capability to make it a hybrid meeting. I haven't had anybody really take me up on that one yet.
Really?
Yeah.
I'm looking at some of these statistics on here about Alzheimer's. Is it I'm assuming the lifetime risk down there in the lower left-hand corner is 1 in 5 for women and 1 in 10 for men. That's not really, I'm guessing, because brains are made differently. That's probably because women live longer, isn't it?
It might play a part in it, but also your stress levels can play a part in it.
Really?
So whenever you look at that next one that says, 70% of dementia caregivers feel stressed when coordinating care and providing care, a lot of the time if you have that sandwich generation, the moms are taking care of their kids and then they may be providing care for their parents that may have to move into the home if they can't live at home alone.
I just read the finer print on that. The lifetime risk for Alzheimer's at age 45 is 1 in 10 for men and 1 in 5 for women.
The age is getting lower.
Oh, see, now you're just scaring the tar out of me even further, Meredith.
I really think you're okay. Usually I can pick up pretty quickly. You're pretty quick, so I think you're okay. But just call the office and I'll schedule you a screening.
Oh, no.
And then you can tell everybody how it's not too bad. It seems bad.
I can tell people I've had cognitive tests. I'm okay.
It's all confidential. I won't post it anywhere. Get on Facebook. No.
Okay. All right. Again, the caregiver. If folks, and I probably should have asked Kris and Brandi this. If folks want more information on any of this, what's the best way to get a hold of you?
Just call the health department and ask for me, 662-4406. Is going to be the best way. I'm sometimes away from my desk, but I always check my voicemails. But yeah, raising awareness in Clay County. So I wrote for and we received the grant just because we don't have a ton of services in Clay County.
Really?
Part of that is probably because when we do have stuff, it seems to be, when I talk to my cohorts around the country that are in this grant, it seems to be that in a more small, rural, tight-knit community, everybody just kind of takes care of their own. And it's harder to admit when mom and dad are slipping and time to take the keys away. Those are hard discussions. But one thing, if you can catch that you're in the earlier stages, when you think of all of your legal stuff that you need to have in play with your, living wills and your medical decisions, but then your property and your regular will, all of that stuff needs to be done before you're you're too far declined.
And I'm presuming that that's some of the stuff that you're going to talk about.
Yes,
at the caregivers meetings. That's And I mean the financial transfers alone are tremendously complicated. There
can be, and then trying to figure that all out. Say, mom goes into the hospital and for a broken hip, but then they realize, oh, she's farther along than we thought.
Yeah.
So then you're navigating the healthcare part along with the legal part, and just the shock of facing it all yourself and the stress. Planning ahead is a big thing.
Planning ahead is huge, isn't it?
It is a huge thing.
That's outstanding, and especially true. And again, how are we celebrating June 21st?
We won't be doing anything this year at the health department because the next day I'm flying out. So
we were talking with the other ladies about having a cake to celebrate. I thought you might want to have a caregiver cake or something like that. I have screwed up her whole day.
Sorry.
That's a Friday.
It's a Friday. I'm heading out. Leaving on a jet plane. So
no problem. Meredith, you gotta.
We may do something later on. We have the grant through September, so we may do a longest
what exactly now? Okay, the grant is for the Alzheimer's
Association.
Okay, okay. Tell me a little bit about this before we run out of time. Tell me what's going on. See, you're doing this on the 21st.
Yes, I will be there for part. I'll be there. You forgot about
this. The Alzheimer's has already started.
I will be there the whole day. I don't normally work in shot clinics, so they haven't decided to let social workers start giving shots yet. I try real hard.
No kidding.
But Lynn won't let me.
I'm surprised by that.
Yeah. She seems to think you should have schooling.
Well, I guess.
No, we have great nurses that work in the immunization department.
I've had Lynn on the show, so I understand.
June 21st is our first back-to-school vaccine clinic. So it's a walk-in clinic. You don't have to schedule any appointments. Kids go into school when they're going into kindergarten. We'll get their 4-year boosters.
Okay.
Going into 6th grade, as long as they're 11, they have to have shots, and then you have to have shots before your senior year.
Really? I was thinking it's good to go into high school.
I thought it was too, but I called the office on my way just to check.
Yeah,
so I didn't give out wrong information.
That's kind of what I don't
have kids, so I didn't know.
Yeah, I would join the club. I got no kids.
I don't know. So January, good grief, June 21st, 9 to 4 is our first clinic date. We do have some dates. I got an email yesterday or Friday, July 21st or July 12th, July 31st, and August 5th.
Always on a Friday.
So, tends to be when people come in better. I would, though, come earlier. When you come, like the August date, it's always very busy and very full because everybody's coming right before school starts.
Right away, they've put it off. And it's smart.
And you can get through quicker usually on the earlier days.
The smart thing to do would to be able to get in there pre-kindergarten, you say, not pre-K.
Going into kindergarten.
Going into kindergarten, going into 6th grade, and going into senior year of high school. What do you get when you're going into your senior year of high school? Any idea?
I have no idea. It has changed since I was in there.
Anti-STDs?
I don't even know for sure what all they do offer. I know there's the HPV vaccine, but I know I'm old enough.
Terribly small joke.
I'm old enough that the hepatitis B shot, like I had to take it for my health occupations class.
Oh, really?
But it was just because I was in that class. Well, now it's a required.
Oh, no kidding!
Grade. Yeah.
I never have taken. Now I guess I'm of a different age. That's a new one to me.
I'm an older age too. So every time I hear, I'm like, oh, I didn't even know they did that. So I'm learning new things every day.
Well, see, that's the thing. You guys aren't giving out. You guys aren't doing the ones we used to have to do when I was a kid. I mean, I had the polio. They
still do a polio.
They still do polio? That's
to my knowledge, yeah.
They don't do it with the sugar cubes, probably, do they?
No.
See, now that was the coolest. Getting the polio vaccines via the sugar. I wonder why more people come down with diabetes.
Probably not because of the polio vaccine.
That was the way to get a vaccine. Was the polio vaccine?
That was before me.
Your
I
time.
Didn't get the sugar cubes.
You didn't get the sugar cubes.
Yeah.
Oh, the sugar cubes were the best. You always enjoy the sugar cubes. All right, let's go back before I get you out of here. Let's go back to this again. This is when? This is June 12th.
Wednesday,
June 12th at 10 a.m. at the, or you can go ahead and scan that, we'll get you registered for that. And again, this is on June 21st. The Start Smart, the school shot clinic. And keep in mind, folks, again, the Alzheimer's Association stuff, as that is something that, hey, if you get older, you're more likely to have to deal with it.
yeah. And the numbers are going up. I would say one of the things that they do mention, so to do it really quickly,
you better
plaque
out of time.
Going into your blood vessels and arteries and veins in the brain, just like in your heart, can lead to dementia and stuff. So they say a healthy diet, lots of exercise, being active, keeping your brain active.
There you go, folks. There you go, folks. Thanks very much for tuning in. Meredith, thanks for being here.
Yeah,
we'll see you all next time on Big Talk. Have a great day.